Welcome everybody, and thank you for joining us for our third webinar. I can't believe we're already in the third webinar of our Digital Health Disruptors conversation series. This conversation is organized by Holland IQ's Health Intelligence Unit to really look at and hear from innovators who are operating around the realm of digital health and disrupting it. My name is Bethany Hogan. I'm the Vice President of Client Experience and Strategic Partnerships at Holland IQ, and I'm joined by Vernon Baxter, our Vice President of our Health Intelligence Unit. Hi, Vernon.
Hi, everyone.
And today we have a very special treat because we are joined by Dr. Mala Mawkin, the Chief of Staff at the Leva Clinic. Hi, Mala.
Hi, guys. How are you both doing?
Wonderful. Great to have you here today. So today's session is all about pain points, disrupting chronic health management. And we have a really great perspective joining us because the Leva Clinic is the UK's first online chronic pain management clinic and really, really well connected into the UK health landscape with partnerships with the National Health Service and the largest pharmacy chain, Boots UK. Dr. Mawkin has a very impressive list of accolades, including Forbes 30 Under 30, Vogue UK 10 Rising Female Stars, Women of the Future UK Awards finalist, one of the UK's most influential people in digital tech. Are you sufficiently embarrassed yet, Mala, or should I keep going?
Yeah, very embarrassed. Thank you. It's very kind of you.
We're really excited to hear more from you today, so thanks for joining us. So before we kick into the conversation, just a little bit about us. If this is your first time joining us, welcome. If this is your first time learning about Holland IQ, great to see you. A bit about us: we support the world's global impact economy with a client community spanning across health, climate, sustainability, and education. And our clients are, really leading this space in a lot of different areas, be it governments and NGOs, technology companies, organizations in really rapid growth, universities and academia, investors, really you name it. But we're very proud to be supporting all of them. And we're trusted by the world's leading media. We are one of the most trusted sources for all things happening in the global impact economy. And in the last year, we were referenced in 3,000 press citations. So that's always nice. And before I hand over, just a quick plug about our upcoming summits. If you're into any of the topics we're describing and you're interested in impact, education, climate, health, all of it together, this is a really great conversation to be part of. In addition to running virtual discussions like this one, this is a really great opportunity to engage in person with impact leaders worldwide. We're going to be in 14 locations all over the world with a 100-day virtual community spanning at least September to November, and I think a bit before that. So definitely have a look out if any of those locations or that program sounds of interest. We're really looking forward to having people join us then. Quick housekeeping. The recording of this session will be sent to you by email afterward. And we've got another session next week. Is that right, Vernon?
Yeah, that's correct.
Perfect. So have a look out for that too. And without further ado, I'll take us back here and hand it over to Vernon.
Okay, thanks, Bethany, and welcome everyone. And just before we get started again, just want to thank you, Mala, for agreeing to participate in this. We've got lots to cover today in terms of your business, but also to hear a bit more about your kind of experience and various roles before Leva Clinic, including as a doctor in the NHS. So I think, bearing in mind, Mala, that we're going to have people watching this webinar from across the world, in the US, in Asia, in other parts of the world, I think it would be really helpful to give some kind of context about the Leva Clinic and where it kind of sits in the UK system. I think, this series is meant to look at kind of digital health disruption. And I think just two kind of points to start with, obviously this is the UK's first online pain clinic. So my first question is, why is that? And then secondly, what is the problem that you guys are trying to solve? Why has this business come into being? And give us a bit of an understanding of where you kind of sit in our system.
Such a good question. And thank you so much for having me again. It's a real pleasure to talk with you guys. Where to start? I suppose let's take a step back into pain in itself to kind of understand where we've got here, right? pain as itself is a fairly new-ish specialty compared to most of the other medical specialties that you've got. It was something that, was very much, as far as we know, came from post-surgical pain, where patients were coming back and they were still having pain over and over again in the 60s. And that was mainly in America. And then the anaesthetists realized that they needed to carry on giving these patients opioids, et cetera, et cetera. And so the clinics started forming. And then as time went on, we started understanding a bit more of mind-body, a bit about why we have receptors where if we hit our elbow and then we rub it better, why does that actually feel a bit better? So where does that, all the pain receptors sit, and how does it all interact? And then as we kind of got a bit more into the last, I say 10, 20 years, we started really understanding the concept of what we call at Leva Clinic the 3Ms, which is mind, movement, and medications, which all combined is that holistic viewpoint that which anyone with chronic pain needs to be taken into consideration for a very thorough care plan. And so it's really been a very recent change that's happened alongside very recent developments in digital health. So both the spaces have been kind of learning as they go and have been leaning on each other. Now, from what I've just told you, you can understand that pain in itself is very complex. And I'm sure you guys know people that have got pain and live with pain at the moment, friends or family. 1 in 3 people supposedly live with pain. I reckon the numbers are actually probably worse than that. We just don't capture it. And so with that being said, you know that it's not just a simple thing that makes it better. Many people find that there's like a variation of toolkits, and that is very complex for digital to solve. Normally, when we try and solve things with digital and with health technologies, we try and pinpoint a problem and fix it with a tech stack or a solution that can fix it. Now, pain was always seen as quite a complex thing. And so when I met the founders of Leva Clinic and they said, we're thinking of trying to digitalize this pathway for a patient so that they don't have to go to the physiotherapist and then to this doctor and then the rheumatologist and then back to the orthopedic doctor. It's all in one place. It was a no-brainer. And so I've been here for 2 and a bit years, started off as an early employee and then worked on our partnerships, as you very kindly read out, with Boots, the NHS, and just really understanding the pathway. We have a team of patient inclusion advisors who sit with us to make sure that everything we do has got patients at the center of it. And yeah, I suppose that's what's brought us here today.
Great. Can we, without going into too much detail, because I know that this is a big topic, but maybe it'd be useful to understand a bit more about the regulatory environment which a business like yours operates in, because obviously the nature of how pain is medicated and also the way that it manifests in ways that aren't always kind of visually presentable. How much of a hurdle was that to get over in the UK market? Going back to that point about it being the first online pain clinic, how much concern among regulators were there in terms of that digital interface dispensing drugs that can have potential to be addictive, as you alluded to?
Huge. I mean, my favorite topic is digital safeguarding, and I actually gave a talk about it with NHSX because I am very adamant that we kind of had to create the rule book when we started. We got our CQC license, Care Quality Commission, is how we're regulated in the UK. So any clinic in the UK needs to be registered with them if they're doing medical treatment. We were one of the first ones to get a secondary care license for a clinic that's fully online, so no in-person presence. And what does that mean? It means that if any emergencies happened or any tricky situations, you're fully online still. So you need to have all that safeguarding regulation and rule books. That we have pages and pages of safeguarding. And this can go all the way through from, if you're on a virtual consultation, how do you detect domestic abuse? What do you do about child safeguarding if there's a child in another room whilst you're doing a virtual consultation? You've got data privacy. You don't know who's listening in the room. You don't know if the records are going to be safe when you're emailing back and forth. We need to make sure that we have things like 2-factor authentication and all of our cybersecurity up to date. So, I mean, there's so many things that could go wrong with safeguarding. And so the regulatory piece is huge. I suppose that's really from the CQC point of view. But then also we've got the medicines, as you say, as well, which in the UK is regulated. We have nice guidelines, but we also have the MHRA, which sits there as well. With pain, you might have seen very recently in the news that new NICE guidelines came out, which suggested a more holistic care plan approach was appropriate for patients a lot of the time with long-term pain. And I think that one of the things that could do was potentially scaremonger patients that they might not be getting the medications that they wanted or needed or have been on for many years. But I think what the outcome of it has been is that we're moving forwards here, but we don't want to get caught up with a very old school mentality of medication solution. As we move into the digital era, there are digital therapeutics on offer. We have social prescribing, which we can do remotely, and then people can have access to it. There are so many other things that could be of benefit for people living with pain. And so I think that there is more to come and more regulation on the way as well. And also at Leva Clinic, the last thing I'll say on this is that we prescribe medical cannabis as well, which is an unlicensed controlled drug that we prescribe and has its own regulatory problems that come with it, and it's all extremely by the book. So everything we do has to be, triple thoroughly checked and has to be really, really well safeguarded, because we have to protect the patients, especially when we're doing it remotely. I don't know if that answers your question, but hopefully.
Sure, and I'd like to come back later on about some of the points around what's regulated and how digital therapeutics are kind of even considered or thought of by the regulators. I saw this morning that Big Health's Sleepio has now been accepted by NICE, which is an interesting kind of breakthrough in that kind of sleep coaching kind of world. But just again, for the context of those watching from around the world and trying to get their head around the system, could you maybe share a bit more about, I suppose, your business model as a clinic and help people understand how, I suppose, reimbursement flows through the system, where your referrals come from? Is this a kind of B2B, B2C, or B2C to V sort of proposition?
Is it very funny that you say those ones? I knew you'd ask me this. But, I think that the model in the US is going to be a very different model to what you see here in the UK because of the insurance play that you've got there. And they're very, very different in regulation that you've got, and also statewide regulation, especially for some therapeutics, etc. And also the concept of liability. So actually a very interesting concept that we have here in the UK is if you suggest something online or a digital treatment for a patient and it might not go very well, whose responsibility is that? Is that the clinician that suggested it, or is it the product manufacturers, or where does that liability sit, and who's insuring that right now? So, I mean, that's another kettle of fish. We'll go into that another time. But here in the UK, the business models tend to be very similar for most digital health companies. So most companies will start doing a proof of concept, and that will mainly be B2C. So like you'll find with Big Health or like other digital therapeutics or any digital offering that you find, we started having patients that could self-refer in. So they would ask to be part of the clinic, and then we would contact their GP, their family doctor, and we would get a referral letter. And that was kind of the first play. And that would be where the patients would pay for themselves to have the treatment. Now, in the UK, the model is that patients aren't used to paying for treatment. So it's a very small set sample of the population that would be able to pay for it with the disposable income, with the ability to pay for it. And also you're playing with pain, which is typically a portion of the population which is living with a lot of social inequalities. They might not be able to work. They have problems with their pain in general, which means that they might not have the disposable income that you might expect from other portions of society, should we say. So I do think that these are all things we took into account, but the whole point is that at the start you need to prove outcomes. And with healthcare, that is really, really important. So anyone getting into the digital health space, like Big Health did as your example, you must prove that what you're offering is actually beneficial to the patient before you can then start going further and going B2B, B2C, et cetera, to the NHS. So once we had started proving that the patients were actually benefiting from the platform through our audits and regular reviews, then we were able to then go to the NHS, go to our different partners, private healthcare, to the likes of Boots, which is the pharmacy chain, and show them the evidence so far. And then we can develop new models. So either that they refer in, patients still pay, or it could be a B2B offering like the NHS, where they will bulk pay for patient care on a like 10 patient, 100 patients, 1,000 patients, and then those patients will have free care as if they were having it through the NHS. It's almost like, subcontracted over to us.
Yeah, capitated model.
Exactly. So it's just it really depends on the patient and of the partner that's part of it. But the ultimate goal would be that the NHS funds different parts of the healthcare system, and so that's why we're working very closely with NHSX currently in their digital adoption fund to understand a pathway where we could do a digital pain management pathway, and we're doing that and deploying that across Southeast London right now, and hopefully it will be able to prove concept so that we can start having more interesting conversations where more patients can have access to this without having to pay out of pocket for it. Again, ask me any further details you need on that, because I don't know where the level is that you need me to go into.
Yeah, sure. And in terms of, so the logical next steps for Leva Clinic as a business is proof of concept and then dissemination through the NHS system. And I'm just interested to see, I mean, you're obviously active in the digital health community. I know you have your own podcast, and you've very kind of sort of publicly involved in this kind of community. Can you maybe give us a few thoughts on how the culture has changed over the last couple of years about digital adoption, and whether or not we're in a environment that's more amenable to businesses like this? Because without being too cynical, like clearly in the UK, we've seen many great ideas wither at the kind of pilot stage and, pre-pandemic. And I'm just wondering how, as we sort of learn to live with COVID, or we've been through the last 2 years where, things have largely lived remotely or online, are we operating in a different world? And are you starting to see that now in terms of, the attitudes of commissioners and decision makers?
Such a big question again. And I mean, I'd actually ask you yourself, like, do you use any online healthcare tools at all? Any apps or any like wearables or virtual consultations ever? Like, have you ever tried it?
Yeah, it's interesting that you asked that, because, because I have another question about how the extent to which the worried well and the kind of early adopters maybe skew the kind of data in this kind of world. But for instance, I live in Surrey in the UK, and Livy has a partnership with My Primary Care. And what I find kind of, this is a super personal anecdote, but just kind of gives you an observation into how digital kind of can work, is that whenever I've used the system, it works brilliantly until you get to the pharmacy. And then when you go to the pharmacy and you try and explain to them that I have a prescription and it's come through a digital channel, I've had some, I mean, this is probably super anecdotal, but I've literally stood there in the pharmacy when someone's gone to turn on a computer to print off the message from Digital Health. So
at least it's not a fax machine, right? But
you joke, but I think, I mean, you probably from bitter experience know that's very true, isn't it?
Exactly. But this is the thing, it's still so early for use cases, and even for the experience that we all have with trying to access it, it is really clunky still, and it is really manual and painful in so many elements. And I think that a lot of it has come from there is a driver and there is budget for innovation, but is it actually embedded innovation is another question. And so one of the big things that we always get asked is, where are the examples of innovation happening in the NHS? Like, where do they sit, and who can give us some actual, use cases? Because it is really difficult to, and I'll use these words, but I'm only using them for want of not having another word here. But there's a want of separating the gimmicks in digital health from actually kind of the long-term sustainable things. So a lot of the time you have you have different areas within the UK specifically, and you do find it in other segments as well, especially in emerging countries. So I was working in Malawi looking at digital health there for a while as well. And you find that you'll get healthcare professionals that will be very tunnel vision to focus on their solution and their problem and their problem that they're currently facing, but it isn't a scalable problem. And so you asked me at the start, what's the problem we're solving? And the problem that we have here in the healthcare system is that everyone has a slightly different variation of the same problem you're trying to tackle. And then you can get 500 different variations of digital ECG machines, or 500 different variations of different types of primary care toolkits, because each of them is slightly different, but they all kind of do solve something slightly different as well. And so what we will, and I predict that we will start to see over the next few years, is the maturity in the market, which I suppose why players like yourselves are getting into this market right now, and why it will be huge, the work that you guys are doing, because we're going to start to see the mergers happening, the kind of the price adjustment of companies that have been valued quite highly kind of coming back down now to a bit more of a reality check post-COVID. We're going to have the commissioners really understanding how to commission, because they were kind of not really understanding it at the start, because it was more test cases and pilots, and they had budget and they needed to use it and they didn't really know how. But now we're getting more and more into to people having that understanding in the background, and patients also knowing what they like and don't like, which before we didn't really have any insights on. We kind of just guesstimated that maybe patients would like wearing a wearable to track their heart rate, and we didn't really know if it would work or not. And now we're getting that data. So I reckon in the next 5 years or so, we're going to start to really understand how technology and healthcare is going to start to synergize a lot more and become a bit more of one, rather than like gimmicks on top of pretty rubbish infrastructure, and then they're not really gelling properly, if that answers.
Beth, I think you might be on mute. Sorry. Oh, I think we might have lost your audio, Beth.
Okay. Oh no, I want to hear.
I'm sure Beth had a fascinating question, but Beth, are you back?
She's gone. She might write it in the chat, then you can ask it.
Well, I think what I was going to ask, but we'll just I'll give you one more chance, Beth. No, I'm afraid we've had a technical failure here. So Mala, I think what's interesting, what you said about the almost like different generations of digital technology we've had, because it makes me think of, I remember going to the early launch of a very UK-centric example of Babylon in 2010, and been at the press conference, and back then, it's an idea that made a lot of sense, but you saw how many years it took for that to take traction. But now when you see businesses like Babylon or Teladoc in the US, those kind of platform plays where they're connecting patients with clinicians, it feels to me, and I'd be interested to get your kind of opinion on this, whether or not those kind of like direct platform plays, whether or not all the easy wins might have already been had with that type of digital interaction, and maybe what you're engaged with at the moment, the kind of knotty, systemic, complex marrying together of that kind of old archaic infrastructure. From my perspective, when I look at the businesses that I'm seeing flourishing in our kind of platform and the ones that we're tracking, I think you see different texture and different types of businesses where they are in the world. I mean, I think if you look across Asia and Africa, for instance, that kind of direct consumer market is much more responsive. But in the US and UK systems, it seems that a lot of businesses with digital prowess are solving some of the complexities and inefficiencies that have been, I suppose, almost baked in or built in over the years. Does that sort of resonate with your kind of experience of trying to bring digital innovation to a niche of the sector, or something that interacts across multiple layers and multiple organizations?
There is so much there to unpack, but it's so true. It's like everyone, when you look at primary care, it can be easy to say, well, it's done. But primary care as a system in the UK, so family doctors are being completely overworked, they are underfunded, and there is a shortage of doctors that work in it and healthcare professionals in general. And so why is that happening if we've done it with digital? Surely digital should have sorted it out, right? And so you just think like there is so much of a market opportunity there to go in and like fix the next layer. And I think that, you know, we talk very much about like virtual consultations, and that's really old school innovation, right? Like virtual consultations, there's nothing innovative about that, right? Now what's going to be really important is like asynchronous messaging, making sure that patients can take more, like have more identify more with their health than they do right now. I think that we have traditionally as a society been very lenient on going to the doctor to get a diagnosis, whereas now we're seeing a culture of patients are taking much more of a responsibility here. So where will that change with it as well? And I think that as we do that, patients will start identifying as and noticing certain symptoms and things that they're identifying with, and then they can seek out the tools that will help them as well. So I think it's like a bit of both. I think that there is definitely work to be done in interoperability, making sure that the techs like all integrate with each other to make sure it's more seamless for the patients. But I do think as well, like on the other side of it, you do need the patients to like, for example, how many patients do you know that would say that they live with pain? Like, people don't go around saying that. They don't identify as having chronic pain. And, you know, it's easier to identify something with like cancer or diabetes because it's something that people know that you should be identifying with. But, you know, it's just alien for some things, and we're still trying to drag that out. So I think there is so much to be done here. It's just about like engaging with everyone and making sure that we can start getting momentum on things that aren't gimmicky anymore and focusing time and attention onto actually solving the infrastructural problems, which is going to be the building blocks for moving forward. I don't want to go into a rant, so I'm going to stop there.
Clearly, it's a very kind of personal thing that you're motivated by. And I think it'd be useful, Mala, to talk a little bit about why you decided to, I suppose, you know, becoming a doctor, incredible amount of training, effort, time goes into qualifying. And I just wonder if you can maybe kind of share some insight into what kind of made you decide that actually you're going to put that aside, you're going to focus on digital health or entrepreneurship, and how was that kind of decision received, and also how do you find it talking to doctors now, now that you're in industry or in technology?
Oh, fun. These questions keep coming. So good. Okay. So my personal mission is to help solve healthcare inequalities and social inequalities using technology. And that really did stem from, I did a bachelor's during my medical training in global health. And that's where I started my work with the European Space Agency and with Malawi, and also went out to Harvard's Digital Health Accelerator as well in Boston, which was brilliant. And so I think that with that was where I wanted to go. And so pain for me is something that, well, when I found out about the opportunity, yeah, you have to see it from like a doctor's point of view. Patients are treated in like an unspoken hierarchy when they come into the hospital, right? So you'll have like your road traffic accidents, which will get like everyone's attention, and then it will go down, and it will be like, you know, someone with cancer, and there's someone with a long-term problem like diabetes or heart disease, and then you're going down, and then there's like a weight of judgment that appears when someone is coming through the revolving door with pain. And you know, they're treated like dirt. They're just treated like, why are you coming back in with pain? What can we do? And that just frustrated me so much. So I was like, well, of course there's more, but I had one lecture at med school on pain. And so it's so unsexy. It's so unglamorous, but so many people are affected by it. And I was like, well, this is a chance to make it sexy and glamorous, to digitalize it, to get people excited, invigorated by it. And it was also combined with novel therapeutics like medical cannabis, where I'm like 1.4 million UK patients currently self-medicate with cannabis. And yet the market is still very small because it's only it's only been able to be prescribed since 2018, and most people don't even know it. You're able to get a prescription of cannabis in the UK for your pain. So I think that there's just so much there that dragged me into this, and then I got hooked by the people that were also in the space that shared very common values and themes about social inclusion.
I just want to quickly get a bit more detail on that point you made around, I suppose, a de facto kind of healthcare rationing that takes place in the UK, because I mean, we all understand the UK system to be free at the point of use, and it doesn't come out of your pocket, it comes out of your taxes. But you know the system, you've worked within it. The budget is finite, it's set, and that drives a certain kind of decision making kind of culture. It kind of has to, otherwise, where does the money come from? And I'm interested in the extent to which digital health in some medical circles has been accused of driving demand, and in some ways of, I mentioned the Worried Well earlier, and some of the diagnostic testing companies, for instance, have been criticized for maybe driving people towards conditions that they either are kind of false negative for, or wouldn't have presented with in any other circumstances. Do you get that sort of interaction with people from within the system?
Such a difficult question, because it really depends on who you speak to. And I think it's also like the younger people that you talk with. So you talk with Gen Zs, right? And the new generation of people coming into the workforce are so here to not only like be their authentic selves in the workplace, but also to own their own data and their own records, and they know what they want. And it's a very different conversation, right? I know personally, and I can speak personally, and I can kind of give my kind of industry viewpoint, but personally, I don't see why it would be ever too much data to have on your own healthcare, as long as we present it in the right way to patients. But giving autonomy back to the patient, I don't know, it sounds to me a bit too paternalistic when we try and remove options from patients. I believe that all of us should have the ability to know what's going on with our own healthcare at any given time. And it's a privilege that we're even debating whether or not we should have access to it, and whether or not it drives the system. However, when it is driven by like revenue, that's where it gets fuzzy, because the more tests you have, like you see what I mean? Like, it gets a bit fuzzy. But you have that with every industry. We're not the first ones or the last ones to deal with this. The finance industry have had to deal with it. Like, everyone has to deal with social system, politics. Like, and I just think that we almost need to like learn from the other industries here about it. Now, obviously, if there are problems with demand as well, I don't think the answer is just turning it off. I think that it's more about, this technology's here and the tests are here, and it's only going to be here. We need to know how we're going to be able to live with it and actually build a society that can work with that, rather than trying to slow it down, because it's going to just come faster and faster. And here's the biggest thing, and I'll leave you with this one, is that if we don't catch up as like a healthcare system to what the private sectors are doing within healthcare, very quickly we're going to lose the ability to have a say in it as well, because the gold standard will be set by people that we might not want it to be set by. And then it's harder to remove things once it's already in place. And so my urge is that we, within digital health, as quickly as possible, build different frameworks. Like, for example, Web3 and the metaverse, we should be having a framework right now in place, which is like, where is this going? What is healthcare going to look like in a decentralized world? Healthcare data records, things like that. Like, it should not be that the people that are building it are deciding it. That's just dangerous, right?
Yeah.
Again, I'm going to go into a rant, so I need to stop.
Look, Mala, I think we probably have time for kind of one last question. So I think it'd be great to. Oh, actually, I think Beth is back.
Sorry.
She has her question.
I'm back. Oh, great. Yeah, sorry. I just have one question I've been really keen to ask during this conversation. Well, I have a lot, but I'll keep it to one because I know we don't have a ton of time. First off, Mala, really agree with a lot of what you're saying. And I think that's really reflective of what we hear from stakeholders and clients, and that's not just within the realm of health. That's also in education and sustainability and beyond, that being part of a broader conversation. And I think the way you framed it as embedded innovation was such a great point. Maybe I could start with Vernon, and then maybe Vernon can hand it over to you. But I'd love to hear, this idea of a 360-degree approach to solutions and partnerships and delivery, which Leva is such a good exemplar of, with the structure of partnerships you have and the way you're working with patients and hearing them. Vernon, any other organizations you can think of or best practices that reflect that kind of interconnected or systemic approach to a broader landscape, and where there are perhaps the greatest opportunities and also maybe challenges?
Yeah, thanks, Bethany. I think in terms of picking out specific ones, I might not do that right now, but just give a bit of context on one of the things that Whole and IQ does, and we're doing in 2022, is that in 2021 we mapped the world's top 1,000 by geography health tech startups, and so as part of that kind of exercise, across literally the world, we've been through and classified them against kind of growth rates, CAGR growth rates, and broken the top 1,000 into our kind of taxonomy. And I think what's interesting looking at that kind of cohort is that you find some businesses that have a bit of technology, and that's what they have, and they want to apply it to healthcare. And that's a pure play. There might be AI, it might be metaverse, it might be VR, whatever it is. It's very technology led. But actually, if you look at the businesses that have continually raised funding and getting traction, they don't just do one thing. What they do is they understand the systems or the ecosystems that they interact within. And this is why I think what you said, Beth, interesting in terms of Leva Clinic and the challenges Mala is facing, kind of getting that sort of innovation off the ground, is that I think for digital to really thrive, it can't be a replace all kind of threat to an incumbent system, because healthcare is just too robust and too well entrenched, and it will just repel it, or it will sort of stifle it. And that seems to me my observation of looking at literally several thousands of companies globally that are trying to kind of crack this nut, is that it's very difficult to have that magic bullet that suddenly replaces everything that came before it. It's about bringing innovation and understanding to a kind of complex system. And Mala is someone who's actually trying to do it rather than observing those kind of patterns. Does that kind of marry with your sort of experience?
I love that. You're completely right. And I love both yours and Beth's points about this. But I think that I think that there is a real need now to be showing two things, like a sustainable business case here for digital health, I think is really important. I think that we get caught up sometimes with, not us, but like the industry gets caught up with funding and valuations. But in healthcare, it doesn't matter. Are you showing patient benefit, and do patients want to use it? I don't care who's buying it. Are patients using it? And then the second one is, are you actually revenue generating? Like, are you able as a business to sustain, or are you solely reliant on raising your next round at an inflated valuation and then also grants? And so I think that what we're starting to see here is that you know, back to my original wording, like gimmick, is that you're seeing that now we're kind of getting into the era now of healthcare technology where businesses are becoming businesses, where startups are becoming businesses, and then some startups are becoming like hobbies. And I think it's going to be a really, really, and I'm sure you guys saw it in education and sustainability, all of those. I think it's going to be a really, really interesting turning point now post-pandemic to see which of these become, wonderful solutions, but very kind of stays within their area, locally used by a few people and solves a problem, but isn't really a scalable business that's going to be, one day listed on the NASDAQ or et cetera, compared to businesses which will be acquired by the big dogs or will be growing exponentially. And I do think a lot of it is down to, dare I say, one of the other points which I always talk about is that you get well-intentioned healthcare professionals that start these companies with no training on how to actually build a business. And so, this is what's going to be coming out over the next few years. And I'm really excited that people like you guys and, other industry veterans from other big industries like education, like other technology plays are coming into healthcare. And I think that this is the shared knowledge that we've been missing here. And this is what's really going to accelerate it forward.
Great. Well, Mala, I mean, it's clear, I think we could go on for quite some time on a number of topics, and I just want to thank you and, mainly for your insight, but also for your kind of passion and energy about this topic. And, as you say, it is becoming more embedded, but it's far from complete in terms of healthcare's digital journey. And I think that kind of process of maturity, the process of some of these, let's say, gimmicks or the novelty of digital health is going to probably fade away, but some of the more kind of mature, serious, entrenched elements of digital kind of improving the system, I think that's where the big wins are going to be for healthcare globally. And it's exciting to be able to track that and watch organizations like yourself kind of take these problems on head on. So it's thanks from me, Mala, and I'll pass over to Beth to wrap things up.
Echoing, thank you. That was such an interesting conversation and great to hear your point of view, and really excited to watch the progress that the Leva Clinic has ahead of you guys. Really exciting stuff. And Vernon, of course, thank you. Join us for our next webinar next week. It is exactly 7 days away, almost 24 hours from there. We're going to be looking at how teleradiology is transforming health diagnostics. So really kind of zooming into another facet here, which will be a really wonderful conversation. Everybody have a great rest of your day. Recording will be sent to your inbox afterward, as we discussed. And yeah, join us for the next series. And thank you both again.
Thank you. It was really, really lovely speaking with you both. So thank you so much.
Thank you both.
Bye.